Human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome, AIDS, are two of the most significant public health challenges of the past few decades. Despite advancements in treatment and prevention, the global impact of HIV and AIDS remains profound. Awareness, education, and action are crucial in combating these diseases and supporting affected individuals. This comprehensive guide explores the nature of HIV and AIDS, their impact, prevention strategies, treatment options, and the importance of continued awareness and support. HIV is a virus that attacks the body's immune system, specifically targeting CD4 cells, T cells, which are crucial for immune response. If left untreated, HIV can severely damage the immune system, making the body more susceptible to infections and certain cancers. AIDS is the final stage of HIV infection. It is diagnosed when the immune system is severely compromised, and the individual develops one or more opportunistic infections or cancers. AIDS signifies that HIV has progressed to a critical state where the body's ability to fight off diseases is significantly weakened. According to the World Health Organization, WHO, and UNAIDS, there are approximately 38 million people living with HIV globally. Despite significant progress in treatment and prevention, the epidemic continues to affect millions, with sub-Saharan Africa being the most heavily impacted region. In recent years, there has been a global decline in new infections and AIDS-related deaths, thanks to advancements in treatment and prevention efforts. The impact of HIV and AIDS extends beyond health. The disease affects families and communities, often exacerbating poverty and inequality. Infected individuals may face stigma and discrimination, which can limit their access to healthcare and support services. The epidemic also places a significant burden on healthcare systems and economies, particularly in regions with high prevalence rates. Certain groups are at higher risk of contracting HIV, including higher exposure to HIV due to occupational risks and social marginalization, increased risk due to higher rates of unprotected anal sex and stigma, risk from sharing needles and other drug paraphernalia, discrimination and higher rates of HIV prevalence, increased vulnerability due to lack of access to education and preventive services. Consistent and correct use of condoms is one of the most effective methods for preventing the transmission of HIV. PrEP is a medication taken by HIV-negative individuals at high risk of infection to prevent HIV acquisition. Providing clean needles and syringes to people who inject drugs reduces the risk of HIV transmission. These facilities offer a safe environment for drug use, reducing the risk of overdose and HIV transmission. Regular HIV testing is essential for early detection and treatment. Many people with HIV are unaware of their status, which can lead to ongoing transmission and delayed treatment. Pre- and post-test counseling provides individuals with information on risk reduction, treatment options, and support services. Pregnant women with HIV can take ART to reduce the risk of transmitting the virus to their baby during pregnancy, childbirth, and breastfeeding. Comprehensive sexual health education in schools and communities helps individuals understand how to protect themselves and others from HIV. Campaigns that challenge stigma, promote testing, and provide information about prevention methods are vital in changing attitudes and behaviors. ART involves taking a combination of HIV medicines daily to suppress the virus and prevent progression to AIDS. ART helps individuals maintain a healthy immune system and reduce the risk of transmitting HIV to others. Adhering to ART is crucial for its effectiveness. Missing doses can lead to drug resistance and increased viral load. People living with HIV need regular medical care to prevent and manage opportunistic infections, such as tuberculosis and pneumocystis pneumonia. Routine vaccinations help protect against infections that can be more severe in individuals with weakened immune systems. Support groups, counseling, and mental health services are essential for coping with the emotional and psychological aspects of living with HIV. Proper nutrition and access to food are critical for maintaining health and supporting the immune system. Stigma and discrimination can deter individuals from seeking testing, treatment, and support. Fear of judgment or social exclusion can prevent people from accessing necessary services. The stigma associated with HIV can lead to mental health challenges, including anxiety, depression, and social isolation. Educating the public about HIV transmission, treatment, and the realities faced by people living with HIV helps to challenge misconceptions and reduce stigma. Advocating for policies that protect the rights of people with HIV and ensure equitable access to healthcare and support services is crucial. Ongoing research aims to find a cure for HIV and develop a vaccine to prevent infection. Recent advances in gene therapy and vaccine trials offer hope for future breakthroughs. Innovations in long-acting ART formulations and treatment modalities aim to improve adherence and quality of life for people living with HIV. Global organizations such as UNAIDS and the World Health Organization work towards ending the HIV epidemic through collaborative efforts, resource allocation, and strategic planning. Engaging local communities in the fight against HIV ensures that interventions are culturally appropriate and address the specific needs of affected populations. Ensuring that prevention, treatment, and support services are accessible to all, regardless of socioeconomic status, gender, or geographic location, is crucial for ending the epidemic. Providing education, resources, and support to empower individuals living with HIV and those at risk is key to fostering resilience and improving outcomes. As we conclude our comprehensive exploration of HIV and AIDS, it is essential to recognize that the battle against these diseases requires more than just medical interventions. It demands a holistic, unified approach that integrates awareness, prevention, treatment, and support. The journey towards ending the HIV/AIDS epidemic is complex, but with collective effort, innovation, and empathy, significant progress is achievable. Awareness and education are fundamental in the fight against HIV and AIDS. By increasing knowledge about how the virus is transmitted, the importance of testing, and the available treatment options, we empower individuals to make informed decisions about their health. Educational initiatives should reach diverse communities, breaking down barriers of misinformation and stigma that often hinder effective prevention and care. Public campaigns, school programs, and community outreach efforts play a crucial role in fostering an informed society, where people are equipped to protect themselves and others from HIV. Prevention remains the cornerstone of combating HIV. Safe sex practices, harm reduction strategies, and proactive testing are critical components of a comprehensive prevention strategy. Access to preventive tools like condoms and pre-exposure prophylaxis, PrEP, can significantly reduce transmission rates, while needle exchange programs and supervised injection facilities address the needs of high-risk populations. Regular HIV testing and counseling are vital for early detection, allowing individuals to begin treatment promptly and reduce the risk of unknowingly spreading the virus. The advent of antiretroviral therapy, ART, has revolutionized the management of HIV, transforming it from a fatal disease to a manageable chronic condition. ART not only helps individuals maintain a healthy immune system but also reduces the viral load to undetectable levels, minimizing the risk of transmission. However, treatment adherence is crucial, and ongoing support is necessary to ensure that people living with HIV can access and continue their medication. Managing opportunistic infections and providing comprehensive care, including psychosocial support and nutritional assistance, further enhances the quality of life for those affected. Stigma and discrimination remain significant barriers to effective HIV prevention and care. The fear of judgment and social exclusion can deter individuals from seeking testing and treatment, exacerbating the spread of the virus and the challenges faced by those living with HIV. Combating stigma requires a multifaceted approach, including public education, advocacy, and supportive policies. By fostering a culture of empathy and respect, we can create an environment where individuals feel safe and supported in seeking the care they need. The global nature of the HIV/AIDS epidemic calls for a coordinated international response. Collaborative efforts between governments, non-governmental organizations, healthcare providers, and communities are essential in addressing the diverse needs of affected populations. Investment in research, particularly in the quest for a cure and vaccine, as well as the development of innovative treatment approaches, is critical for future progress. Ensuring that resources and support are equitably distributed, especially to high-prevalence regions and vulnerable populations, is vital for achieving global health goals. Looking ahead, the goal is clear: to move towards a world where HIV and AIDS no longer pose a public health threat. This vision is within reach if we continue to advance research, expand prevention efforts, and provide comprehensive care. Every step taken towards improving education, increasing access to treatment, and supporting affected individuals contributes to a broader movement towards ending the epidemic. In this journey, the role of individuals, communities, and policymakers cannot be overstated. Each person's actions, from practicing safe sex and getting tested to advocating for equitable healthcare and supporting those affected, plays a part in this collective effort. By harnessing the power of unity, compassion, and innovation, we can create a world where HIV and AIDS are no longer a source of fear and suffering but are managed with the dignity and care that every person deserves. As we reflect on the fight against HIV and AIDS, it is important to remember that progress is not just measured by statistical outcomes but by the lives transformed and the barriers broken. The journey is ongoing, and while challenges remain, the progress achieved so far is a testament to human resilience and collaboration. By continuing to raise awareness, advocate for effective policies, and support one another, we can ensure that the efforts to combat HIV and AIDS are sustained and strengthened. In conclusion, the battle against HIV and AIDS is a shared responsibility that requires ongoing commitment from all sectors of society. Let us move forward with renewed determination, guided by the principles of empathy, equity, and action. Together, we can build a future where the impact of HIV and AIDS is significantly diminished and where every individual has the opportunity to live a healthy and fulfilling life.